This is a doctor that was supposed to do the surgery on a little 11 years old girl. So my people, listen to what he got to say and tell me what you understand of the whole situation. And after we listen to him, we will go to Christopher Tufton and listen to what he got to say and see if there is any relevance in what Christopher Tufton is saying to what took place. Because all that Christopher Tufton is doing is trying to shift the blame and trying to place it elsewhere and trying to run away from accountability and responsibility. Christopher Tufton, honestly, from my opinion, need to step aside as the Minister of Health. What he has done, he need much more to make Jamaica Health System better. It need way, way much more. And Christopher Tufton ain't showing that interest or giving us that effort. Simple. My opinion. Now, listen to what the head doctor got to say, my people.
There are some amazing people at this hospital. The doctors, the nurses, the physicians, the residents, and we take great care of these kids. But there are some clear infrastructure issues here. Okay, I've been coming here for 20 years. There's some very clear infrastructure issues that need to be solved. You know, I made a request 2 months ago when we heard the air conditioning issues. I said, we need to fix it, or you need to make accommodations somewhere else. Now, the fact that they want to make accommodations, make the decision today to do it tomorrow, that's not right. That's not right for the patients. You know, and my request was ignored. So I think that if you know, this is the only children's hospital currently on the hospital in the island. We're probably the most technologically advanced Caribbean island in healthcare wise. We have to be the gold standard. Our hospitals have to be the gold standard. And we have to, people come from other islands so we can take care of their children because we know that our healthcare system is good and we have to maintain that. And so we have to go through the hospitals, make sure you're absolutely correct, the autoclave systems are working. You know, we can only do single instruments now, that's an issue. The air conditionings have to work, and we understand this is an old hospital. There's other things that we need to do to fix it. But these need to be addressed and fixed, and the money needs to go into helping these children. And I come here twice a year. I bring a whole team. We donate thousands of dollars of equipment because we want to help these people. And you guys have to put the infrastructure in place for allow us to do that. It's absolutely necessary.
My people, doctor explain it all, you know. This man is not a Jamaican man, you know. He's an overseas doctor who came into the island to do the operation free of cost with his team. So when he speak, we got to listen. Now, let us listen to what Christopher Tufton got to say and see if it make any sense or it adds up to what the doctor just outlined to us. Because this man like to place blame and run away from responsibility and accountability as the Minister of Health. So, my people, let us listen to what he got to say. Okay? And in the meantime, please like and share, comment and subscribe, my people. Welcome all new viewers at the same time.
It does not make sense for us to spend so much money, buy all of these equipment. The first little thing that comes up, you hear that you have to wait 6 months for it to be repaired. Whether it is an operating theater or a piece of diagnostic machine. So what are we doing as part of the build-out? Well, for starters, we're going into leasing of equipment as opposed to purchasing. Leasing with service contracts. There's a service contract here with CAC. But even with the service contract, we're being told that the part has to be manufactured and it takes 5 months. And I think we're going to have to sharpen that up, because what it essentially means is that even in the case where the supplier has an ongoing agreement, the supplier still is maintaining the risk on the health system as opposed to them bearing some of that risk by stocking inventory. So the technicalities of how we maintain and where inventory is held and who holds it, because holding inventory carries with it risk. It's money to hold inventory, it's risk to store it. This idea that you manufacture on demand with a gap of 5 months or 6 months in an essential service where you have a hospital that needs an operating theater to work, it's not tenable. It's not tenable. So we're going to have to sharpen up those agreements once we insist on extended service, whether through leasing, which we are going to, and in another month or so we'll announce for the big diagnostic equipment like the CT scans and so on. So they will automatically be required to repair and to replace after they are depreciated through their useful life. We're going to have to even tighten that up more to say you're going to have to stock some of the basic parts of some of these equipment. You can't wait until it breaks down, and you have to service it routinely and change it routinely so it don't break down. We're going to have to look at the policy around what are the backup systems that are necessary in the case of it, and why it is that a split system properly maintained may not have been clinically possible 10 years ago, but for temporary arrangements and proper maintenance it's possible now because of technology. We're going to have to revisit that. Thirdly, we signed service level agreements with the regions, and since that time we have established a committee on the former Prius brand. I'm awaiting the report from that committee. We're in keeping with the build out that is taking place. We're going to have to now look seriously at engaging external sources around maintenance of the plant.
Christopher Tufton said all of what he got to say, my people. Now let us listen to what Dr. Dawes got to say, who is in the medical field, who is in the system daily, and listen to how we break it down.
So thanks again for joining, and I guess you would have known who I am, Dr. Alfred Dawes, and I am the caretaker for Southeast St. Catherine constituency for the People's National Party, and I am here in my capacity tonight as the shadow spokesperson on health and wellness. Now, those of you who would have been following the news today would have heard the story of the little girl, an 11-year-old, who was denied surgery on her spine. She has scoliosis, which is an abnormal curvature of the spine, and she needed surgery to straighten that spine out because it was getting more and more curved, causing significant pain for her. And the mother took to social media because of the frustration with getting the surgery done, and that has prompted a tour of the Bustamante hospital where it should have been done, and a press briefing. Now, I have been contacted by several persons who are very concerned that the tone of the press conference and the picture that is painted of the Bustamante Hospital for Children, the Caribbean's largest pediatric hospital, is a rosy picture that is being painted, but the reality on the ground is that people are suffering. And we're not just talking about the users, the children and the parents. We're talking about the staff, the frustrated staff who they have been complaining about the state of the hospital for some time. Written letters, they have gone out of their way to try and solicit and donations in order to improve the hospital. We hear about the issues with the Shaggy Foundation, a lot of bureaucracy involved, a lot of money tied up, and the project's not getting done. So there's a lot of frustration pent up within persons who have to use the facilities and those who are trying to help the facility to get better.
Listen to what he got to hear some people, and you will understand that Dr. Christopher Tufton is an evil, conniving man to the people of Jamaica when it comes to the health system. Just listen keenly.
And what we saw today never sought to reassure those persons that their concerns were genuinely being looked at. Instead, what we saw was an excellent performance in crisis management And I say it's a performance in crisis management because all that came out of it was a very deliberate attempt to kill the story by trying to say that the little girl is going to get her surgery done. A lot of blame shifting as to why we got here, and that's the end of it. But there are deep-rooted issues at the Bustamante Hospital that need to be addressed because it's not just one person who will be facilitated at the University Hospital who has been affected. There are many children out there who are suffering because of the dilapidated state of the operating theater. And until we address those issues, we're going to continue to see cases like this popping up from time to time. Now, when we say that things are bad in the public health sector in Jamaica, we are accused of politicizing the state of affairs. But if you think that things are bad, I can assure you they are only going to get worse.
You hear what the doctor just said, my people? People, this is serious, you know. And right now we got to wake up and realize we got to demand more and better from who is in charge of our system, who we put in charge to serve us. Simple.
I can say this, not with a willing heart, but because of where I sit and the stories that come to me and the assessment of the situation, the approach of the policymakers of the Ministry of Health towards the issues, I can tell you that they are not making any meaningful attempts at fixing the broken healthcare system. And the system will continue to be overburdened because the population is aging. We have more and more chronic diseases that are not being controlled and monitored. We have increased cancers that are not being screened for, so they present at a later stage where it's much more difficult to treat them and more difficult to get a cure. Also more expensive, which further takes out money out of the public healthcare system. But then when you look specifically at the hospitals, we do not have a proper preventative maintenance program. So do not listen to the sweet talk about equipment being bought and how much money is being spent. For one, we are overpaying for a lot of these equipment. And I'll say quite frankly, there are a lot of hustlers out there who just buy cheap equipment from China, sell it to the Ministry of Health, and then they're deployed in hospitals. They do not know anything at all about maintaining these equipment. You cannot get the parts for them. And because they're just hustlers, they don't have an organized, an arrangement with the manufacturers to service these equipment. So naturally the equipment are going to go down. The other thing is that even when you have legitimate suppliers, there are no maintenance contracts that are budgeted for when these equipment are purchased. So we can talk a lot about how much money is being spent, but the Jamaican taxpayers and the users of the public healthcare system are not getting value for their money. And this is why we're going around on this hamster wheel where we have broken down air conditioners, we have broken down ventilators, broken down ambulances, broken down elevators.
What is here, my people, is that, the system is broken, and the health system is in crisis, and need urgent attention, like now, immediately. You understand?